So I'm Dr. Emmett Harrison, and I'm a family and emergency physician in Swift Current, Saskatchewan. I've always lived in Saskatchewan and grew up in Moose Jaw, and I train at the University of Saskatchewan. Love practice in the province so much that I've decided to stay. I knew early on in my training that family medicine was something that I really liked, due to the variety of practice and the relationships that you get to foster. One of the things that I wish physicians knew about practicing in Saskatchewan is that there's a lot of funding for innovation and team-based care. So, for example, we're working with community pharmacists right now to help with their expanded scope to work collegially to meet the needs of our patients for access. We are working with nurses at the top of their scope to help meet the needs. Team-based care is not something that we're just taught in medical school. It's something that we're able to live in Saskatchewan. And if you're a physician considering coming to Saskatchewan, we have the connections here to fit you in that right team. I'd say if you were a physician thinking that coming to a small community like this would limit their career, I think that is a myth. I think it's very much the opposite. So coming to a smaller community, there's more needs or gaps to be filled. And if you have a desire to meet those, usually the community is able to meet you because they want you to stay. My experience has been transformative, really. Being able to help, be in the process to create something bigger than ourselves has been amazing. Having on a daily basis patients tell us how thankful they are to be at our office and how appreciative they are about the quality of care that they're giving, I think is the best feedback that we've got. So the Patients Medical Home is not a new thing. In 2011, the College of Family Physicians of Canada has created that as their vision. It has lots of benefits, from being more timely for care, access to care, providing care where patients need it at the time that's best suitable for them. We monitor things on the quality of their care as well, and are open to gain feedback from our patients. So it's driven by what's important to the patients too. So not only are we integrating into our processes like different allied health professionals to complement our team, we're measuring, tracking, and setting goals on how we can best integrate them. And so having a continuous quality improvement lens to it, and like common goals, and having a physician lead be able to come in and have some training in that is something that I think is very important. We don't know if we're making a difference unless we have the data or we measure it. Having things like daily huddles, opportunities to meet to come up with goals, and integrating patients into that process is something that I think, instead of co-locating, having those health professionals in the same place, we're going, the next step and making sure that things are integrated, efficiently and well-oiled. To me personally, as a physician, it's provided me some of my personal time back. So it's decreased administrative burden for me, able to finish my paperwork within the workday, which is big, so that I can be at home, with my wife, my family. What I enjoy best about living and working in Swift Current is the people. So the people being the patients and my colleagues. It is a community where you can host many events and you'll never be short of volunteers, even though there's 17,000 people. People are always willing to help. We always joke that you can get anywhere in Swift Current with the length of one song that you listen to on the radio. So that makes it quite a bit easier to get from one place to another. You're not stuck in traffic. There's more personal time that way. I've been able to integrate outside opportunities into my career by having, colleagues that are quite supportive of my interests, and I help in turn support their interests. So we're able to, have a variety. Variety is spice of life, right? So with being a teaching site, it brings in things like research, fresh perspectives, the ability to teach. And so, I encourage, physicians and practices such as ours to teach as well. Per capita, we do pretty darn good for having, physicians stay here in this community, and that's allowed some opportunity for, wellness and work-life balance. So there's lots of us to support you and support you being well. Saskatchewan is calling. Grow your practice, grow your life.